Welcome back to the Senior Living Show. I'm Vicki Rogers. With me today is once again one of my favorite guests of all time. Woo! His name is Scott Neal, who is the president of D. Scott Neal Incorporated, and he is the founder of CaregiversCircle.com. Welcome back.
Thank you, Vicki.
Yes, we are talking about controlling the cost of health care, which is a huge, huge task and undertaking. So how does one become an empowered patient? That's the word you're using, and I want you all to explain that to everyone.
Yeah, I think one of the ways to control your personal cost of health care is to become an empowered patient. You know, Dr. Atul Gawande, who wrote the book Being Mortal, one of my favorite books, he briefly describes the evolution that healthcare has made over the last, say, 20 or 30 years or so. Back when I was a child, I remember my pediatrician very, very well, and he was, shall we say, paternalistic. You know, he told my mother exactly what he wanted to do, have done, and she better get that done, and all the nurses and all that sort of thing. Well, that's the way healthcare was, even in the days of Dr. Marcus Welby, MD, and Dr. Kildare, and I'm dating myself now. Even when they had a great bedside manner, they were still paternalistic. So we evolved that into, when I was doing pastoral care training at the medical center in the 90s, it seemed to be all about giving of information. The doctors would give all the patients all of this information, expecting them to make a decision. Well, the patients didn't know didn't know how to decide, all that sort of stuff. So that really didn't work either. More recently, we've seen a shift in healthcare providing healthcare to a more collaborative model, or what I call a collaborative model. And that is that the doctor tries to get to know the goals and the needs and the resources of the patient before prescribing a particular area of care. The only problem with that is that doctors are now so busy keeping track of all of their electronic medical records that sometimes they don't have time to spend with you in the exam room that they would like to do in order to be able to do that.
So what is the key to becoming empowered?
I think education is key. You know, we have rights, and we should educate ourselves about our rights as patients, but we should also educate ourselves about the responsibilities that we have for as a patient. You know, I think that one of those is that we need to be prepared, well prepared for our visit to the doctor. We need to kind of plan that. You know, for some people it becomes a big event. I think it did for my mother, in fact. You need to plan it. You need to write down what's going on with you, your symptoms, your health, your medication regimen, all of those kinds of things. And so once you get there, and while you're making the appointment, if it's a very complicated issue that you're going to have to be dealing with, I think it's a good idea to ask for extra time during the appointment. That scheduler is set to schedule that doctor's appointments on a certain regimen, and it's okay to ask for additional time. Write down the questions that you want to have answered during the appointment that you have. Bring those with you as you come in, and listen carefully to the answer. Sometimes you'll hear medical jargon, and I would press the doctor on speaking in layperson's terms. Before the visit is over, I want you to make sure that you know what the next steps are and what the outcome is going to be. If the doctor prescribes a particular test or procedure that needs to be done, I think it's a very valid question to ask what the doctor plans to learn from that test and what impact it might have upon treatment. If you don't get a good answer to that, then ask the question, is it really necessary? Right. You know, so these are the kinds of questions that I think we have to press on our healthcare providers to drag them into, well, that's probably a strong word, dragging them into, to lead them into being more collaborative with us. If medication's ordered, find out what the risks are involved in that. There's a wonderful website called the U.S. Preventive Services Task Force. So I encourage people to go there and learn all they can about what is being prescribed for them. It's a group of collective healthcare practitioners that have, I think all of them are volunteers, that have posted all of these kinds of things on the website. Ask what you can do to improve your situation. You know, sometimes diet could improve the situation. We never want to hear that, well, you got to eat right, you got to exercise. But there are certain things that you might be able to do that would improve your situation. Now, if you're just too ill, or if you just don't want to engage the healthcare professional in these kinds of things, then Then it's time to bring in a trusted healthcare surrogate, or we've talked about that before, a healthcare coordinator. And that could be a family friend, it could be a relative, it could be someone paid to do that. Nurse practitioner or nurse case manager could come in and help you to do that. I firmly believe that these things are necessary in order for us to engage in this new way of doing medicine and taking care of ourselves. And the frustration that it will relieve on the family and in many cases on the healthcare provider themselves is just enormous. And it could reduce, like I said, could end up reducing the cost of healthcare in the United States.
And where can folks find out more, Scott?
Come join us at caregivercircle.com. We talk about things like this.
And we'll be back with more in just a minute on the Senior Living Show.